Hello, citizens of Internet, and welcome to this comprehensive masterclass on pelvic endometriosis. I'm Dr. Ajit Virkud, a professor of obstetrics and gynecology. Today, we will delve into the complexities of pelvic endometriosis, providing you with a detailed understanding of its pathophysiology, diagnosis, and management strategies. Through this session, we aim to equip you with the latest insights and evidence based practices that will embrace your clinical skills and patient outcomes. Whether you are a seasoned practitioner or a student eager to learn more, this masterclass is designed to expand your knowledge and facilitate excellence in patient care. Thank you for joining us, and let's get started on this educational journey together. Quite often, I like to think out of the box. Once, when I was in this mood, I thought to myself, what if adenomyosis, fibroids, and endometriosis were related pathologies? For a long time, I couldn't get a satisfactory answer. And then, all of a sudden, while taking a lecture on adenomyosis for postgraduate students, it hit me. If adenomyosis, fibroids, and endometriosis are one family, then fibroids are the paternal cousins of adenomyosis, and endometriosis is the maternal cousin. One more out of the box thought. 90 years ago, in 1927, Dr. John Sampson coined the term endometriosis. But I think this is a misnomer. Let me explain. The inner lining of the cervix is called endocervix and the outer lining is named ectocervix. So, using this analogy, if lining of the uterus is called endometrium, presence of endometrium outside the uterus should be called ectometrium and the pathological term should be called ectometriosis. Makes sense, doesn't it? Let me know in the comments section if you agree with these out of the box statements. This comprehensive masterclass is structured into four distinct segments. The inaugural segment will delve into the epidemiology, etiology, theories, and pathogenesis of pelvic endometriosis. The subsequent segment will focus on the clinical manifestations and diagnostic criteria of the disease. The final segment will provide an overview of the medical and surgical management approaches for pelvic endometriosis. Endometriosis is a benign, inflammatory, estrogen dependent condition in which tissue corresponding in every respect to the endometrium, that is, glands and stroma, occurs outside the uterus. It is not seen before puberty and after menopause. When endometriosis is present in the pelvic sites, it is called pelvic endometriosis, and when it occurs outside the pelvis, it is called extrapelvic endometriosis. The most common sites for occurrence of pelvic endometriosis are the ovaries, followed by the uterosacral ligaments, pelvic peritoneum, pouch of Douglas, rectovaginal septum, and sigmoid colon or appendix. In rare cases, endometriosis can invade the vagina, bladder, skin, lung, spine, and brain. About 7 to 10% of women of reproductive age are affected by endometriosis. 38% of infertile women have pelvic endometriosis. It has been reported in 10 to 15% of women undergoing diagnostic laparoscopies, 2 to 5% of women undergoing tubal ligation, and 71 to 87% of women with chronic pelvic pain. What causes endometriosis exactly is not known, and hence many different theories have been put forward to explain the phenomenon. Since one theory cannot explain all the types of endometriosis, other theories have been put forward from time to time. These are Sampson's retrograde menstruation theory, Halban's theory, coelomic metaplasia theory, omnipotency theory, and mechanical theory. One of the most popular and widely accepted theory is the Sampson's theory of retrograde menstruation. According to this theory, during menses, a certain amount of menstrual blood is forced backwards through the fallopian tube into the abdominal cavity. Usually, the body responds to this retrograde spill by reabsorbing the menstrual fluid. However, in some women, possibly due to an immune dysfunction, the endometrial tissue implants itself and continues to grow at this ectopic site as endometriosis. Halban's theory proposes that endometriosis occurs due to the spread of endometrial cells through the lymphatic system and bloodstream, essentially suggesting that distant endometriotic lesions can develop via hematogenous or lymphogenous spread of viable endometrial cells, explaining the presence of endometriosis in locations beyond the pelvis. Coelomic metaplasia in the context of endometriosis refers to a theory proposed by Robert Mayer in 1903 that suggests endometriosis develops from cells lining the pelvic cavity, peritoneum, which are capable of transforming into endometrium-like cells under certain conditions, essentially changing their structure and function to resemble the endometrium, a process known as metaplasia, thus explaining how endometrial tissue can grow outside the uterus in various locations within the pelvis. This also explains why most endometriosis implants are found on the peritoneal surface of the pelvic cavity. Ivanov's omnipotency theory, promulgated in 1898, suggests that the multipotent cells of the coelomic epithelium change to endometrial tissue. It has very few advocates today. According to mechanical theory, endometriosis is a result of direct mechanical transportation of endometrial tissue to ectopic locations. This iatrogenic mechanism explains the presence of endometriosis at the sites of episiotomy scar and laparotomy scars. If you like this OBGYN content and want to learn more about this topic, please join my affiliate membership program. The details are as follows. Hello citizens of Internet. Hope you're all doing well. I am Professor and ex-Head of Department of Obstetrics and Gynecology, Dr. Ajit Virkud from Mumbai, India. Today I am excited to introduce to you an exclusive opportunity to deepen your learning experience with my channel membership program. By joining, you will gain access to high quality, in-depth content that I have created specially for you. There are 3 exciting membership levels. First, the basic level. This level provides access to select videos and shorts that will help strengthen your foundational knowledge. It's perfect for those who want a taste of what we offer without committing too much. Second, the priority level. At this level, you will have access to all our theoretical topics. This is ideal for those who want to ensure a strong theoretical understanding and wish to stay updated with the latest advances in obstetrics and gynecology. And finally, the premium level. This is the ultimate package. You will receive everything from the basic and priority level, plus exclusive access to both theoretical and practical topics. This includes my masterclasses on various critical themes and the privilege to watch orations delivered by me in India and abroad. It's a comprehensive learning experience designed to equip you with the knowledge and skills to excel in your career. By joining this membership program, not only will you get access to all this incredible content, but you will also be supporting the channel, allowing me to continue bringing to you the best educational material possible. So what are you waiting for? Click the join button below and choose the membership level that best suits your learning needs. Thank you so much for your continued support. Together, let's embark on this educational journey, and I will see you on the inside.